Diabetes affects approximately 130 million Americans and growing. I'm Dr. Richard Gomendoza, endocrinologist, Salina Regional Endocrinology.
Dr. Gomendoza, thank you so much for being on the show. We're going to be talking about diabetes. What is diabetes?
Well, thank you, Mike, for having me again. So diabetes is high blood sugar with certain criteria. So we diagnose people with diabetes if they have fasting blood sugar of 126 on 2 occasions, or we can diagnose them by this simple test called a hemoglobin A1C, which checks their average blood sugar over 3 months. And if somebody has an A1C of 6.5% or higher, that qualifies them to have diabetes. And another diagnostic criteria is a random blood sugar of 200. Anyone with a single random blood sugar, you check them anytime and it's over 200, that is qualifies them for having diabetes. And then we're familiar with also doing the glucose challenge, pregnant women, and if the glucose testing 75-gram blood sugar after like 2 hours is over 200, that's also diabetes.
Let's talk about treatments for diabetes.
So some medications target the pancreas deficiency of insulin. Some medication target the kidneys, increase reabsorption of sugar, and some medication targets the liver's overproduction of sugar. And what's very exciting, and it actually recently just came out in the market, a new medication that actually targets the stomach hormone called incretin. So it depends on what the core defect of the diabetes is. That's the medication that we use. So it can be oral, it can be injectable insulin or injectable non-insulin regimen. The core management of diabetes, be it type 1 or type 2, remains trying to exercise more consistently. The American Diabetes Association recommends 30 minutes a day, 5 days in a week. You can obviously do more than that, and you can tailor that based on how conditioned you are, and making better dietary choices, which again is very hard or challenging for most of us, myself included. But that overall is kind of the gist of how we manage our diabetes patient.
What are some of the problems, other diseases and problems that diabetes can render?
So end organ damage is what prolonged uncontrolled diabetes can cause. So it can affect the eyes, the nerves, retinopathy, neuropathy, the heart, macrovascular heart disease, heart attack, stroke, kidney disease, end-stage renal disease requiring dialysis.
Thank you so much for some great information. And thank you for watching. For more information, please visit SalinaRegionalEndocrinology.com and like Salina Regional Health Center on Facebook and follow us on Twitter and Instagram.